5 free papers to be presented by our presenters and selected by the abstract committee. Now this is, we have two judges also. You will be, the presentation will be judged by two judges, and the results will be given at the end of today's last plenary session. And then some what's called now the presentations, you can take only 8 minutes. The bell will be ring in 6 minutes. Then you will be allowed to you can take only 2 minutes for the discussion. Then altogether 10 minutes for the presentation, again 8 minutes for the presentation, and 2 minutes for the discussion. And you will be notified. We are ringing a bell at 6 minutes time and 8 minutes. Then you will be notified by, I think, 3 bells, I think. Then 2 minutes for discussion. That is the rules and regulations for this session. First presentation is on hit or struck by person versus object. Experience from Batticaloa District. This is the authors are Dharshini K, Sukunan G, Udhayakumar E, Dharshini K will be the presenter. Over to you.
Good morning, Chairperson, judges and the audience. Very good morning. Sorry about that small delay. So our topic is hit or struck by a person versus object. This is an experience from Batticaloa District. An injury is any physiological damage to living tissue caused by immediate physical stress and can occur intentionally by a person or unintentionally by an object. Both can cause blunt or penetrating trauma. Injuries are number one cause of hospitalization in Sri Lanka over the past few decades, and more than 1 million people are hospitalized each year with injuries. So injuries kill nearly 1,200 annually and it's number one cause of morbidity and mortality among economically productive age. So today's our analysis objective is to determine the proportion of injuries due to being hit or struck by the objects and by person, and also to describe the features of inpatient admissions with hit or struck by objects and by person. So the method, actually this is a desk review using the data that was available at the RDH's office retrospectively, and so these secondary data were extracted from injury surveillance form of Sentinel Site hospitals in Batticaloa District during a three-year period from 2020 to 2022. And we included all 5 Sentinel hospitals. So Batticaloa District has 5 Sentinel hospitals, 1 teaching hospital and 4 base hospitals. So total of OPD and in-ward patients admitted with injuries were taken and as the denominator, and administrative approval was taken from the RDH's office. So the 3 years analysis of the major 6 injury causes in the district. The first one is animal bite, transport and fall. So all these years the focus in the Batticaloa District planning and implementation was focused on these 3. But the hit by the person and the object, even though it's in the first 6, it was neglected. So we thought all these 3 years, still it's in the among the first 6. So the deeper analysis would give us a more in-depth problems why this is happening in the district. So the results, the proportion of hit or struck per person for the years 2020, 2021 and 22 were respectively 11.6%, 10.9% and 11%. And the proportion for hit or struck by an object for the same year is 9, 6 and 7.6%. And the males were affected predominantly, and most prevalent age group ranges from 20 to 50 years by both types of injury. The number of deaths reported by hit or by the person is, for the person is 847, and for the object it is 143 in the same years. So the inpatient death analysis, you see the struck of hit by an object, patients reported in inpatient. The numbers are increasing in 21 and 22. 20 maybe probably it's underreported due to COVID. So if you see the age for both types, it's the productive economical age, which the highest peak is in 2030 and 20 to 50 years, where the both types, it's showing the peak results. And if you see the body region, it slightly differs because the object is more in the limbs, and struck by a person is more in the head region. And if you see the affected body region, and then the place of struck or hit by the person is nearly 72% is at home, and also the object of hitting also nearly 7% is occurring at the home level. And the evidence of alcohol, we expected the yes to be more, but it shows the data nearly about 95%. The results came as no, according to the surveillance forms. So the conclusion, hit by a person is more prevalent than hit by an object in Batticaloa District. Head is mostly affected hit by person, and limbs are more affected in hit by object, and both types of injuries occurred mostly in their houses. So based on this, we recommended because this is a desk review, so we need further studies to determine the causes and the associated factors with these 2 injury forms. And also because the more by the person is more, that is intention injury is more, so the mental well-being promoting programs to the public, and also the place of the injury is more in home. So in the district we would recommend home should be a more safer place, and the government has, NCT unit has introduced a home safety checklist. So that should be monitored throughout the district. So the limitation in this desk review is only the sentinel site hospitals were selected, and there were some incomplete forms, and due to COVID-19, 2020 and 2021 data may be underreported. Thank you.